We are Dalton and Emily Potts. We are the parents of Eloise Potts, who's now 2 years old, and Charlotte and William Potts, who are fraternal twins that were treated here at Children's Health in Plano on days 6 through 18 of life on the PICU floor, and I'm also a team member. About 48 hours after we got home from the hospital, William woke up at 5 a.m. with a 100.5 degree fever. And working at Children's, I knew you have to rush a newborn with a fever under 6 weeks to the emergency room immediately. The doctor there said, we need to do a spinal tap. And so at that point, they realized that he had meningitis, and we were waiting to find out if it was viral or bacterial. So I got settled with William in his floor, and Dalton went home until the next day.
And started taking care of Charlotte, and she continued to spit up a lot, and so we decided, just out of an abundance of caution, her brother's already there, let's just take her in and make sure that nothing's wrong.
What we saw with Charlotte was that she had both a malrotation, which is that the things weren't where they needed to be, and then there was this blockage. And so we didn't know about the blockage up front. We had to try to figure that out. And then ultimately, once we figured that out, with a lot of participation from other services at the hospital, we were able to get a definitive treatment done to bypass that blockage and get her back to eating and growing. I'm a parent myself, and I've actually been a parent of a patient at Children's. And so understanding what that feeling is like to be on that side of things is really helpful to remember that for the family, this is a once-in-a-lifetime experience. So I try to really convey, hey, this is important, this is special, this is a big deal, but at the same time, this is something we do.
I met Charlotte in the OR. We were down there for a procedure, and then I brought Charlotte back up to the PICU, and that's when I met Emily and Dalton for the first time.
Charlotte and William were next door to each other on the PICU for 9 or 10 days, and Dalton and I really just ping-ponged between rooms. We would talk about Charlotte during rounds, then we'd go to the next door and talk about William. And they just were both fighting two completely unrelated, horrible things at the same time. But I think what really started to happen is the excellence of children started to kick in. As a parent, to know that you're leaving your child, your 7-day-old at this point, in the hands of somebody who you just met can be terrifying. But Cammie was so calm, so confident, so secure, and so communicative. And I think that just gave me a lot of peace every night, knowing that Cammie was overseeing all the moving pieces between both the twins.
Being a nurse can be hard, especially in the PICU, but having these moments really makes me feel like I'm doing a good job. I'm gonna get emotional.
The continuity of care was just incredible, and that gave us a lot of peace. And knowing that it was Dr. Brewer and Dr. Alder again down there, they'd seen her, they'd already operated on her before. And then it was night and day. After you guys fixed the web, she was quickly moved off the PICU floor, and then she was home 4 or 5 days later. So it was just like Christmas morning when they came in, they're like, time to go.
You really do develop a special relationship, not only the people admitting you at ED, but all the doctors. I think they just spread the word around and were just incredibly impressive.
I think when you start working here, you know it's a special place, and you know our mission is to make life better for children. And you encounter these stories every single day. You talk to these amazing doctors, you talk to these nurses, and when you're in the hospital, you see these parents on the floor and you have a heart for them. But then when the tables are flipped and you're the parent and you go through this yourself, you really just have so much faith and trust and are proud to be part of Children's. I was proud to tell people, oh yeah, I work here. Oh yeah, I'll be back in a couple months from maternity leave. Also, Children's recently rolled out a whole brand new suite of benefits, and including in that was expanded parental leave. And so the fact that I had so much time as a mom to recover both physically from a twin C-section and mentally and emotionally from this hopefully once in a lifetime traumatic event, you can't ask for anything more as a team member. Our Children's family truly was a family when we needed them the most.